So I was talking about actually the hair removal industry. So if you see that the hair removal industry is a $4 billion industry in the US and it's growing at almost 6 to 7%. Now, out of this, the laser hair removal is almost $1,400 million. But the growth of the hair removal industry through laser is much faster than with just the depilatory creams and the temporary methods. This, I just want to emphasize that this is not a treatment just of the present. It's probably a treatment of the future as well, which is just going to keep growing. And it's important to understand that even in India, the one leading cosmetology clinic that is nationwide reports that almost 40% of their revenues come from hair removal. So it's a very big industry all set to grow. And therefore, it's important for us as doctors to understand what is the correct way of referring our patients for laser hair removal. Now, LASER is an acronym which stands for light amplification by stimulated emission of radiation. So a concentrated beam of light is actually focused on the skin through which it reaches the hair to remove the unwanted hair. The principle of laser is such that the light is absorbed by the pigment preferentially in the hair and not in the skin. And this light energy is then converted to heat energy, which damages the hair follicles. By damaging the hair follicles, it either permanently destroys them or sends them into a dormant state where they don't produce the hair for a longer period. Therefore, there's delayed hair growth or completely reduced hair growth. So how does it work really? There are many factors which are important to understand how laser works. One is the color of the hair and the skin type, which is classified by Fitzpatrick into type 1 to type 6, starting from the fairest skin to the darkest skin. Now, laser hair removal works best when you have very fair skin and very dark hair, which is quite easy to understand because then preferentially the pigment in the hair follicle will take up the laser and not the pigment on the skin. However, nowadays we also do lasers for people with dark skin because you can always cool the surface of the skin or use different types of lasers which can penetrate deeper, therefore target the hair follicle specifically. The whole principle of lasers works on selective photothermolysis, which means that should be taken up, the light should be taken up only by the melanin in the hair follicle and not by the melanin on the skin. Because if the melanin gets scattered onto the skin, we're going to get a lot of side effects, including burning, blistering, and pigmentation. And therefore, it's also important to avoid patients who've got tattoos on that area that we're lasing, because even an external chromophore can sometimes take up the laser light and react to that. Now, the very early lasers which came in, like the Alexandrite laser, needed to have very fair skin to work on. But increasingly, as lasers spread around the world, we have now developed lasers which work on dark skin as well. And it's a multi-process complex process that involves a thermal reaction via the epidermis into the dermis. So it is really important to cool the epidermis because you don't want that to take up the heat. You want it to be directed towards the hair follicle. So usually most lasers come with a chill tip, which will cool the surface of the skin while directing the beam of light into the hair follicle. For certain patients who are very, very dark, it might be worthwhile even using a cooling device. Something as simple as an ice pack. You do get cooling devices which are electrically operated. So they can actually cool the skin to ensure that there's no damage on the epidermis and that the light is directed towards the dermis. Now, what are the influencing factors that will actually determine the efficacy of a laser? One, of course, is the energy. We know that higher the energy, more the burning of the follicle. But it's important to understand that higher the energy, also greater the side effects of burning. And therefore, it's important to get a good balance between the two. The second thing is to get a large spot size. The very first lasers which come had tiny spot sizes. So therefore, working especially on larger areas like the legs and the back, you would need to give multiple shots. Now you get spot sizes which can be catered to different body parts. And the larger the spot size, the lesser the scatter to the surrounding epidermis. And also you get lesser collateral damage. The last factor that is important is the pulse duration. And this is dependent on the thermal relaxation time of the skin and hair. So usually for terminal hair, we recommend that the pulse duration should be less than 100 milliseconds. But for Indian pigmented skin, we like to keep it even shorter so that the damage to the skin is much lesser. So I already discussed selective thermolysis. It is important that the laser operator stays within the thermal relaxation time. If you exceed that, by giving your pulse for longer than the thermal relaxation time, then you're transferring the heat to the surrounding structures, and therefore the damage, especially of post-inflammatory hyperpigmentation, is very high. And I can tell you for sure that a patient who comes for a cosmetic removal of hair on the upper lip is not going to be happy if you leave them with blisters or with pigmentation on the upper lip. And therefore, this is a very important factor to take in when we are lasing the skin. Now, melanin is the target, and we are lucky in India that we all are well melanin endowed, that we have a lot of eumelanin, especially in the growing hair follicle. But it's also important to understand that this is a procedure which works very well in hirsutism, simply because most of the hair that grows in hirsutism is the terminal hair. If we have patients who come who are not suffering from hirsutism, then the selection of patient becomes much more important. So what are the factors that affecting outcome? Of course, like I said, light skin with dark hair is best to get the best outcome. But also dark skin with dark hair can be treated by taking the correct precautions and the correct laser system. Now, anagen hair is actually the most important factor in getting a good result, and this cannot be controlled by the dermatologist or the laser operator. But this is the reason why we need multiple sessions, and one session of laser is not enough, because different hair follicles may be in different stages of growth. To attack as many follicles as we can in the anagen phase, we usually recommend 4 to 6 sessions at least, if not more than that, given at monthly intervals, so that we can target maximum number of hair follicles which go into the anagen phase. In hirsutism, I'm re-emphasizing that it's really important to evaluate the patient, to start the systemic treatment either a couple of months before or at least along with the cosmetic treatment with laser, because otherwise it's like cutting the branches of a tree while the roots are still growing. If we do only laser without, conferring with endocrinologists and actually treating the underlying cause, then we're not going to get the best results for the patient. Now, how do we grade the efficacy of response? Of course, the best gradation of efficacy comes from the patient. If they're not seeing a reduction in hair growth and they're paying the money that they are for the laser, they're going to come back and tell us. But there is a scale that is roughly used in each area, where a poor response is less than 25% and an excellent response is greater than 75%. Most hirsutism patients do get a response of over 50%, again, for the simple reason that the hair is terminal, the hair is dark, and therefore it does tend to respond well to treatments like laser. Now, are there any side effects that we need to worry about? In the hands of a good laser dermatologist, there are very, very few side effects. It's a very safe procedure. One of the things that we must always keep in mind is the possibility of post-inflammatory hyperpigmentation. Therefore, using sunscreens after the laser, avoiding sun exposure, and if you see any early signs of pigmentation, treating it immediately is very, very important. Immediately after the procedure, there could be some perifollicular edema. Some patients may develop folliculitis or worsening of existing acne, and the dermatologist must be extremely clear, especially in hirsute patients, to warn them that this can happen so that they don't have a reaction to this. Now, I'm just going to discuss 3 popular laser systems that we use in India. The first one is diode, the second is ND-YAG, and the last is called an IPL device, which is not a true laser. Now, the diode was one of the earliest systems which was used in India, as opposed to the Western world, which used alexandrite, which was very suitable for patients with fair skin and dark hair. The advantage of diode is that it's got a longer wavelength than the alexandrite. It also accounts for different kinds of skin in India. We're a unique country where people who come from up north, like Kashmir and Punjab, could actually fall into a type 2 skin, while people who come from the south, Kerala, Tamil Nadu, will probably fall into a type 5, type 6. The diode is versatile enough to work on both. It's important that the fluence and the pulse duration is customized for each person who comes in. So what I've written here are only indicative joules and pulse duration. Usually, the dermatologist will begin with a smaller fluence for a shorter pulse duration in the first session and slowly build it up as the patient responds well. ND-YAG is actually the laser in India which we have maximum experience with, because as you can see from the diagram, it tends to penetrate deeper because it has a longer wavelength, and because of that, it's much safer for darker skin types. Also, the number of joules energy that you can use is a wide variation. Recently, a study was done comparing, one underarm with another underarm, where lower fluences were used on one side and much higher on the other side. And they found after 4 to 6 sessions that the result was almost identical. So now we are beginning to believe that lower fluences might work well as well, especially in hirsute patients. And where you can use a lesser fluence rather than a higher one, you should opt for that, because the chances of getting post-inflammatory hyperpigmentation are much lesser. Now, IPL is a very interesting device. It's called intense pulse light. It's not a true laser because it actually straddles a number of spectrums as opposed to a laser which has only one wavelength of light. So it's not a true laser, but it's very versatile. You can also use it at much lower fluences. What we need to be careful in India is, again, with pigmented patients, IPL could give rise to more post-inflammatory hyperpigmentation. So if you are going to a clinic which uses an IPL, ensure that the doctor has enough experience to deal with using the IPL on your skin. Now, I just want to tell you that all of these systems are effective. All have given good results, not just in patients with hirsutism, but even in normal people. The thing is, sometimes it can take more than 6 sessions to show results. Sometimes switching from one system to the other can give us a better result. And therefore, as we are gaining experience in laser systems, it's important to share with our colleagues where we are getting best results so that we can service the patients the best. These are just some photographs. These are on 3 different laser systems. Some of the photos have been given to me by my friend, Dr. Kalpana Sarangi. So thank you to her. Most of these are all hirsute patients with upper lip, chin, and sideburn, side lock area, which normally for normal people is very fine hair. But in hirsutism, people is coarse dark hair. All these patients got very good results after 4 to 6 sessions with the fluences I showed earlier. Again, underscoring the fact that it's not the laser system that you use, but the care with which you use it that is important.
Dr. Aparna, 2 more minutes for you. We are running
Yeah.
short.
So, what are the future advances that we're looking at in lasers? That we need better cooling systems. There are some radio frequency devices which are coming into play which could do this even faster. It's an interesting thing to know that a woman shaves herself almost 8,000 times in a lifetime. So, if lasers can get rid of that, any woman will be happy to do it. And there's a new technology that's coming in that's called tracers, which they say will use energy formed differently from lasers to cause less collateral damage. And therefore, histologically, we find that the skin is spared much better. And this is very exciting in terms of being able to cater to any skin type in the future. So, in conclusion, the management of hirsutism is multidisciplinary. Evaluation and medical management is critical, as is a psychological evaluation. And I know you spoke about it earlier when you talked about patient evaluation. Hand holding the patient through the process is very, very important. It's also necessary to set realistic expectations for the patient because it could almost take 6 to 9 months to show results. And quality of life assessment studies are critical. And the last thing I just want to say is across the world now there's a movement to embrace body hair. So we as doctors should not recommend upfront that patients should remove their body hair. It's good to listen to them, understand what they want, and then cater the treatment according to what they need. Thank you so much. It's been a pleasure talking to all of you.